Hi, I'm Gary Bebow, CEO of WRHS System, and this is my November CEO Connection. Today's guest is sort of a bittersweet deal for me, is that both Stan and Megan Towson have decided to retire from their duties here at the WRHS System. Stan has been the Chief Operating Officer of Stone County Medical Center for the last 3 years, and Megan has been our physician recruiter for that period of time. Both have really done an outstanding job, and frankly, I just hate to see them leave. They're not only just performed so well for us, but they're also personally my friends, and I know I and so many of the rest of us will really miss them as being a part of our leadership team. So, on the other hand, you know, I wish them the best in their retirement plans, and I thought I'd just have them come in now and talk a little bit about some of the things that have been going on since their tenure, and maybe some of the things that they think that we can accomplish after their retirement. So why don't I start with Stan. Stan, you know, you've been a long-term Mountain View resident over these years. In fact, you own the hospital when we acquired it back in 1999. And tell me a little bit about the last 3 years, and what do you think is going to happen to Stone County going in the future?
Well, as you said, I sold the hospital in 1999 to White River Health System, and was able 3 years ago to come back. And she asked me to come back and be a COO of the hospital again. And so there have been a lot of great changes made since 1999. The hospital had progressed tremendously, and we had recruited some doctors. We now have 2 orthopedic surgeons. We have a general surgeon. We have 7 family practice doctors. And so the community is growing over there, and the hospital is growing, and we offer more services. We've got digital mammography, for instance, and there are just a lot of new services that we've offered. And it's been a great, great association with White River Health System. It really has made the hospital prosper since we took over.
Well, Stan, you've been an integral part of that whole system. You know, a lot of people might not know is even after you sold the hospital to us, you came on the hospital board, or the system board. So you've never really been too far from the operations, even since 1999, in one sense, in the governance and leadership, and then again taking over the helm back in 2013. So I can't tell you how much I appreciate the work you've done for us, and how meaningful you've been to us.
Well, it's been great, and I think that there's a lot of cooperation between the 2 hospitals, and it really helps us a lot as being a small critical access hospital to have a big brother, so to speak, and have a lot of resources that we can tap into, and it's really helped our hospital tremendously. So, I'd like to say from the Stone County, we want to say thank you very much.
You know, Stan, one thing when we posted your job, we've had some internal and external candidates. I've been really impressed with the quality of the candidates who are interested in taking up the leadership at Stone County. I think you agree that we're going to have good leadership even after you retire. And of course, it won't be you, but I think we'll find some good leaders to go over there and keep that organization progressing just like you left it. So appreciate that. Now, Megan, I don't think we've ever had a better physician recruiter. I know we have never had a better physician recruiter than you. And since you've been at that over the last 3 years, gosh, I don't know how many doctors you've recruited. Do you know how many doctors you've recruited?
37.
Just 37? I think that's pretty close.
Months.
Well, you've just been wonderful. You know, last night we had our Batesville After Hours from the Chamber of Commerce event here, and as I went through the list of new doctors who have joined us in 2016, not only the number were impressive, but just the diversity of the group and the places they got their training. I mean, these are outstanding new additions to our medical staffs, and I really attribute the hard work to you. So I really appreciate what you've done. Tell me a little bit about what you've learned over the last 3 years and where you see it going.
Well, speaking of that diversity, what I focused on was physicians that would fit well and appreciate North Central Arkansas. Even though we've recruited physicians from all over the country, all over the world, it all comes back to their heart. If they're truly a small town rural physician, medicine has changed. I heard time and time again when I took this this role that, oh, you can't recruit to rural America. And I find offense in that, I grew up the daughter of a physician in a town the size of Batesville in Oklahoma, and I have tried to focus on screening the candidates and at looking for physicians that would be a good fit here in our community. Just because they trained in New York City doesn't mean they didn't grow up just down the road. And so.
Done a great job.
Thank you.
Not only identifying those, but sealing the deal and getting them to come here and then agreeing to practice. So it's been a whirlwind of 3 years and all really positive. Now, we've actually selected your replacement.
Yes.
You want to talk a little bit about Jillian?
Jillian Hicks, she's new to Batesville. Has been living in Little Rock area for 9 years, a graduate of Harding University, and she's going to be an excellent addition to the system. She has exceptional qualities that will really complement the role of physician recruitment.
She's a lawyer by training too, isn't she?
Yes. So she's very sharp, and I think she'll be able to go in and definitely seal the deal as well.
Well, I know that we all look forward to her coming on board and following your footsteps. But boy, I'll tell you, those shoes will be hard to fill. And
Thank
so
you.
for both of you guys, as I said, it's really bittersweet. I hate it that y'all are leaving, but I wish you the best in your next phase of your lives.
Thank you.
Thank you. We have 2 excellent Employees of the Month this month. From Stone County Medical Center, Ashton has been recognized for her role in the volunteer program and for great patient care and for working well with coworkers. She's been at Stone County Medical Center for 9 years, and so really well deserved of this recognition. At White River Medical Center, we got Sherry Spearman. She's a registered phlebotomist in the laboratory, and she's been chosen for the respect standard displayed to patients and to coworkers. She's been at White River Medical Center for 18 years. I've seen Sherry a lot over the years and seen how well she interacts with patients and visitors and other employees, and I know for sure that she's a great example of the Employee of the Month that we're all looking for. So congratulations to both Ashton and Sherry, and if given the opportunity, please acknowledge their award. To give you an update on some of our construction programs, our emergency room is nearing completion. During the last week of October, we are having our state inspection, and so I would expect shortly after that we'll be given the okay to move into the new facilities. I really appreciate the hard work of all the staff and doctors and during this transition period of construction. So I really look forward to the new facility. It's really going to be terrific. And sometime near the end of November, we'll have a open house, and everybody will be invited to come at that time to see our new facility. So in terms of the South Side project, that is a little bit behind schedule. We had hoped to have that done sometime in the early part or mid part of October, but it appears that it's going to be delayed, maybe even as late as into end of November, maybe early December, for some unforeseen reasons. So once that's completed, Dr. Shannon Swift and Dr. Ian Parker, a new physician, will be joining us on December 1st. We'll be practicing out there, and I know it'll be really a great service to the Southside community. In terms of the adult psych unit, as we've talked about before, we're expanding that unit from 12 to 24 beds. It's pretty much on schedule. I anticipate going into the new 12-bed area sometime in the next few weeks, early November. Then we're going to go into the older part of the adult psych unit and do some renovation and the like, and so probably in full operation for the full 24 beds sometime near the end of November. So all those projects are moving along, and I'm really pleased. I think you'll all be really pleased with what we have when they're completed. Every 6 months I do an employees forums where in the conference centers I give an update on the progress of the hospital and how we're meeting some of our important metrics. We will put out and announce in advance the different times and dates, and I want to encourage each of you to come and see the employee forum for those employees at Weber Medical Center. It just gives you an update on how we're doing as an institution. And as I've said before, it's so important that all employees understand our metrics and contribute to our successfully meeting them. Because as I said also before, as the organization goes, so do all of us. And so come and see how we're doing, and again, come with the intent of contributing to our success. Each year we do an employee benefits fair at Weber Medical Center, and on November 3rd to November 5th, it will be held in the conference centers. And so more information will be coming out on the benefits fair, and so as in the past, I want to encourage all employees to come and learn more about our benefits. You know, the benefits are really important. There's a lot of the benefits, and this way you can get a better understanding just what you have available to you, and when necessary, you'll know when and how to use them. So come and learn more about those November 3rd to the 5th. I'm pleased to report that Dr. Philip Pack, a general surgeon, will be joining us around the beginning of November. He'll be working in with Batesville Surgery Specialties, and so we're looking forward to Dr. Pack joining us at that time. So if you see Dr. Pack, make sure to have him feel welcome as a new member of our medical community. Upcoming community events, Dr. David Posey will be speaking on November 8th in the conference center at noon, and his topic will be on ulcers. And so if you're available that time, come and see Dr. Posey and hear what he has to say about the treatment of ulcers. Periodically, we have a blood drive here at Weber Medical Center, and on November 17th, that's been scheduled. And again, additional information will be put out. And so if you're able to and desire to, come and give a pint of blood. It's so important that we continue to develop and add to the blood supply in our state, and so participate if you can. Finally, on November 19th, we have a family care health screening fair in Mountain View at the Mountain View Senior Center from 9 o'clock to 11 o'clock in the morning. If interested in participating in the health fair, please be sure to contact Dana Van Adder at Stone County Medical Center at 262-5009. Now lastly, I'd like to talk about the Pep Club that's been started. In October we had a tailgate party at Weber Medical Center. We had 173 individuals of employees attend the health fair, and it really was a great time. And so as of right now, we have 197 members of the Pep Club. PEP stands for Positive Empowered People. And I would encourage each of you to participate. Now, some of the things about the Pep Club is that quarterly there will be events like the tailgate, where members of the Pep Club will come and be able to participate in those events. And also the contributions that are given to the Pep Club will be used by the members of the Pep Club to determine how to best use those. Right now, with that 197 employees who have signed up, we anticipate about $67,500 a year will be raised that way. And so the vast majority, actually probably 75% of it, will be used in different programs that the employee members think are most worthy of using those funds. So if you aren't a member of the Pep Club, come and learn more about it. You can sign up through administration or your directors, or contacting the foundation. And I really want to encourage each and every one of us to be members of the Pep Club. This concludes my November CEO Connection. I appreciate the hard work that everybody gives us on a daily basis. I want to wish you all a happy Thanksgiving, and we'll see you next month.